now. 3, 2, 1, go.
Thank you very much. Good evening, everyone. Ladies and gentlemen, community leaders and residents of Harrow. I'd like to welcome you to this month's COVID community webinar. This is our third in a series of webinars we have been hosting for Harrow residents to give updates and facts around COVID. And I'd like to thank you all for joining us today. My name is Graham Henson. I'm a councillor and leader of Harrow Council. Unfortunately, I couldn't make the last meeting because I had COVID. But what I would have said at that time is that we knew, the variant that came through in December was really hitting our community hard. And, we had to make choices, and that the rate of infection in Harrow was rising very rapidly. And I think it's the work you did as community leaders, as people, how we communicated, that actually kept those figures lower than they could have got. And when we say it's nearly 1,000 per 100,000 people, that's 2,500 people a week were being affected by COVID at that time. As you'll see from the presentations and questions tonight, those numbers are coming down, and the future looks quite good. But I'd just like to thank you all for the work you've done. That's for myself and for the council. Thank you all really for the work you've done to keep the message going about making sure people sort of hands, face, space, take those precautions and keep try and reduce the rate of infection in Harrow. And while they do continue to drop, and we've seen the figures nationally and in Harrow, we are not out of the woods yet. The next few weeks and months are crucial and will determine the success of our collective efforts. However, as the vaccination programme has continued to accelerate, and Harrow is right at the top of the London boroughs in terms of the number of people who have been vaccinated, there is a real hope that there is a clear path out of this emergency. And that is as long as we take our vaccinations when offered and follow the government public health guidance. So as a way of introduction to the webinar tonight and the importance of it, the webinar will update you about the current COVID situation in Harrow. We're looking to provide more details about the ongoing vaccination efforts in Harrow, as well as address any questions and concerns that people might have about the COVID vaccines. And these are genuine questions and concerns, and hopefully we will be able to answer them tonight. So we'll come back to that in the Q&A session a bit later if you want to raise anything. So just to give you an overview of the agenda and remaining panelists, they're just going to share the agenda on the screen in a moment, but one of our first speakers will be Carol Furlong, who's the Director of Public Health, and Carol's the one who advises the council around what we should do and the impact it's having across Harrow. We've been Patrick Vernon, OBE, will be coming through after Carol. Dr. Genevieve Small, who's chair of the NHS Harrow CCG, and is also vice chair of the council's Health and Wellbeing Board. We'll talk about the vaccinations. We've then got a short video which has been produced with Harrow community leaders and health and social care staff. And then we have Dr. Amit Bakai, consultant cardiologist and research director, Royal Fee London NHS Trust. Before I hand over to Sean Harris, who's the Chief Executive of Harrow Council, who will give us an update around COVID across the council, I just want to sort of deal with housekeeping and functionality. So before we start, I'd like to, as attendees of this webinar, you will be able to see and hear the panelists throughout the webinar. You will be on this see and hear mode. This will allow the webinar to go ahead without background noise or other interruptions. If you have any questions during the webinar, there is a Q&A slot towards the end, and you may ask your questions using the Q&A function at the bottom of your screen. Your questions will come across to myself and the other speakers, and I will either answer your question or ask one of the other speakers to answer your question. When you are asking your question, could you please remember to give your full name, if you didn't use that to sign in on the webinar, and the name of your organisation if you have one, because then if we could get back to you with further information if necessary. So during the webinar, I will introduce each speaker before they come in and their background. But first of all, I'd like to invite Sean Harris as Chief Executive to give an update from the Council's perspective. Over to you, Sean.
Thank you, Graham. I won't take too long because I want to make sure there's plenty of opportunity for other speakers and also for people to ask questions, and we'll do our best to answer people's questions in the chat as well as this evening. And any of the questions we're not able to answer during the evening, we'll make sure that we get back to people afterwards. Carol, our Director of Public Health, is going to go through a lot more detail about what the situation is in Harrow in terms of case levels, which are clearly going in the right direction. And also, I'm pleased to report that whilst there's still pressure on our NHS, the situation is much better than it was a few weeks ago. And as Graham has already said, the vaccination rollout is going extremely well, and there's a lot of work that's gone into make that a high level of take up in Harrow. The thing that I just also wanted to add, though, was obviously this week the Prime Minister has set out the grounds and the process for easing lockdown should things go in the right way, that the vaccine rollout is successful, case levels continue to fall, and there is much less pressure on the NHS. And we know over the next few weeks that from the 8th of March, schools will be reopening, and we're working very hard with schools to make sure that they're in a position to be able to do that effectively and safely, and that people will be tested in order to be able to reduce transmission. We also know that as we get hopefully into April, we will see a greater level of reopening in terms of non-essential retail and some aspects of hospitality. There'll be a further expansion of that in May, and ultimately there's a hope that all, if most restrictions, will be able to be lifted by the middle to the end of June. I think it's really important, though, just to emphasise that is all related to a number of things being delivered and being successful, but in particular the fact that we all continue to comply with the regulations, and that we support this process by ensuring that we get tested either when we think we may have symptoms, or by using our asymptomatic test sites, that where we possibly can, make sure that we continue to maintain social distancing, following all the guidance in terms of hand washing, etc., and also that we take advantage of the opportunities that are presented by that vaccination programme. But one thing I just wanted to reassure people of is that the Council is working incredibly hard to maintain all our services during this very challenging and testing time, and that we will continue to work hard with local communities in order that we make sure that we support the process going forward, both in terms of opening schools and also making sure that we're in a position to be able to support the easing of restrictions over the next few months. But just want to continue to say that it's really important that we all continue to work together in this regard, and hopefully by the summer we'll be in a much stronger position. But that's all I wanted to say, Graham, and thank you.
Thank you very much, Sean. Now I'd like to invite Carol Furlong, and she's going to go through a presentation. Carol is our Director of Public Health, and Carol advises the Council and myself around actions we should be taking, must be taken, and is our liaison with Public Health England. It's Carol's advice that drives a lot of the decisions we make, and we have a lot of respect for Carol's advice on the basis now that we've managed to keep the infection as low as it has in some sense. But Carol, if you want to go through the current situation and projections.
Yeah, I've got to unmute myself first, haven't I, before I start talking. Hi. Yeah, I'm delighted to see so many people come to our seminar, and just going to give you a brief update on where we are on COVID. So if I can get my screen to move, there we are. So this is the dashboard that we usually present. It shows the data as of the 24th of February today. And the data relates to the week up to February the 19th. We've had 274 cases, which gives us an incidence rate of 109 per 100,000 people. And as Graham was saying, at one point in January, we reached 1,000 per 1,000 people. So we've come down considerably. What we are seeing at the moment is a little bit of a plateau, which I'll show you in more detail in a minute. The incidence in older people has also come down, and that's at H2.2. And our testing rate, because there's less virus in the community, less people are symptomatic, so that's also come down. But our positivity rate, thankfully, has come down from being 1 in 4 cases being positive to only 5.8% of cases being positive. And you can see the trends in the case rates here, and that's slight plateauing as we're getting closer. What we are seeing is that the numbers, the interim numbers that we've got for the 7 days up to the 22nd is lower than the 7 days to the 19th. So it's indicating that it's still going down, but it is going down a little bit slower. So this gives you more details in the number of cases that we've had every day. This is since the 1st of, oh, ignore what it says at the bottom. It's from the middle of the beginning of November, when we were going into lockdown, up to yesterday's data. So you can see this slight flattening of the most recent data. But we're getting now the number of cases that we were getting before we went into the November lockdown, before we went into tier 3. So we still have quite a way to go before we're getting into the rates that we were seeing last summer, where we were only getting, well, in our best week, we had 1 case in a week. You know, so it's getting 40 to 50 cases a day is still far too high. And just, yeah, I just wanted to remind people that, you know, we've seen the national roadmap out of lockdown, and the only way that will stay on track for us to have that opening up that we're all longing for is if we keep the rates down at this point, then we'll be able to open up. If we don't keep the rates down, then it'll be longer before we start opening up. So the local data shows that the highest incidence that we've got at the moment are in 25 to 59-year-olds. So that's the working age population. So it's people who are not able to work from home, people who are more likely to be exposed to people who are positive. A lot of those people will be essential workers, and then they will then be taking it home to their families. So they may live with older adults in their families, or with children. What's really good is seeing these rates in children coming down nicely from where they were. But bearing in mind that children will be going back to school in 2 weeks' time. So we may see a bounce back in that data at that point, when both they're going out, and if parents have been off work while they're not while they've been homeschooling their children, then we may see a bounce back because of parents mixing as well. And if we look at the data by ethnicity, we can see that the majority, there's not a huge difference in the different ethnic groups, particularly if you, you take into consideration the proportion in the population as well. So we have pretty low rates in the Black community, the white community, and the Indian community, and slightly higher rates in the Pakistani community, but still lower than the average. And the other Asian community is coming out slightly high there. One of the things that this data doesn't show is the difference between those big broad groups, because other Asian will include people who are for example, from Nepal all the way to Sri Lanka, and there's a big cultural differences between those groups. So the other bit of information is that dark line at the bottom, which is other ethnic groups, and we know that there's some misclassification on the records, or there's things that can't be directly classified from GP records. So we do have a number of people who we've not been able to put into those standard groups. So a piece of work is actually being done at the moment in trying to improve that in general practice. So we're hoping that will get better as time goes on, but yeah, it's a sort of indication. And as I said, the things that we still need to do, and I make no apologies for showing this, because one of the things that it illustrates is that no matter what we do, none of these interventions on their own will keep us safe and out of harm's way. So even if we're vaccinated, the vaccine is very, very effective, but it's not 100% effective. But if we build that in with keeping our space, washing our hands, wearing masks, limiting our time in crowded places, ventilating, keeping windows open if you are in an indoor space, isolating and quarantining if you have any symptoms or you're a contact of somebody who's tested positive, and of course the testing program as well, and regular access to testing. Those are the things, when you add them all up, those holes stop matching up and you're much less likely to have the virus. Now, we know that lots of people are going to have the virus asymptomatically, so testing asymptomatically is a really important part of our way out of lockdown, because the more people that we can identify and isolate, the better it is. So we just think about testing for a moment. If you have symptoms, you need to isolate and get tested as soon as your symptoms start. And I put a list here of the places that you can get a test. You book for that test. Sorry, at the bottom there's supposed to be some links, but they've obviously disappeared off the slide. When we share the slides, those links will be back in. But you book a test through the government website, so that's www.gov.uk, and you can click on Get a Coronavirus Test. These are just some examples of where you can get a test if you work outside of Harrow and there's a more convenient place, or you live on the border and it's easier for you to go to a site in Ealing or in Hillingdon, or even in Hertfordshire. Then there's lots of other places as well. If you don't have symptoms, we advise everybody who works outside of their home to have a test twice a week, even after they've been vaccinated, because as I said, vaccination doesn't give you 100% protection, and you may still be able to pass on the virus. So get tested twice a week. We have all of these centres that have got plenty of capacity. And we're advising parents and childcare bubbles to also be tested twice a week, in the week before and every week after, when their children are back at school, so that if their children have become infected by somebody else in school, or if they've become infected, so the children then don't take it into school. So that's really all I wanted to say, and I'm going to hand over to Patrick, who's going to talk to us a little bit about some of the fears that people have about coronavirus and the vaccination programme. Patrick. Oh, you're on mute.
Hi, good evening, everyone. I'm Patrick Vernon. I work as an independent advisor on race equality for Harrow Council. I'm a social commentator. I'm a former NHS manager and sit on the board of an NHS organisation. I took the vaccine about 4 weeks ago now, and I decided to take the vaccine for a whole variety of reasons. Main reason I took the vaccine, that it's about saving lives. Harrow has got one of the highest death rates in London around people contracting coronavirus, and a lot of people of colour have died of coronavirus, and not just in Harrow but nationally as well. I lost my brother-in-law to COVID nearly a year ago, actually. So our family's still grieving. It's really been difficult for my sister, who lost a long-term partner for over 30 years. So it's been difficult. And so in my family, my parents, they're both in their late 80s. They took the virus, so they took the vaccine. And my sister, who is a nurse who works for the NHS, has also taken the vaccine. And all my family, when their term comes, they'll be taking the vaccine as well. So for us, it's about losing a loved one that had an impact on us, and we want to make sure that we're around. I've lost friends, neighbours, other work colleagues, and we have to save lives. There's too many deaths. The second reason I've taken the vaccine is, and I'm sure we'll go into this a bit later around the science of it. In terms of the vaccine, there's been a lot of work being done on the vaccine. I took the AstraZeneca one, but there's been a lot of work done, and there'll be this time next year there'll be at least a dozen on the marketplace. And I know that a lot of people who I hate the word hesitancy. It's not hesitancy. It's about mistrust. Luckily I've done my research work. Going on trusted NHS websites, talking to people I know in health and social care. So these are kind of things I did, and then as a result of taking the vaccine, I've also spoken to other people who've taken the vaccine as well, and people have approached me for advice regarding that. And yes, as Carol said, yes, the vaccine is not foolproof. We know that. It's going to be a way of life for a lot of us, but I don't think you should be compelled or forced to take the vaccine. But it's something that you need to seriously consider. We know there is a long history of how science and medicine has used and abused Black and brown bodies, and those experiences are real. We have to also recognise that we're in the West, and we're quite lucky to have access to a whole range of vaccines compared to other parts of the world as well. So we recognise that. And I know, being a former senior manager working in the NHS, about the whole issue of trust within the staff groupings, trust between services and the community. And I think it's important that we build that trust and confidence for NHS staff and for the wider community as well. I think the issue of trust is really critical to this. And I think what we're trying to say is, we're here to help, we're here to listen, but don't feel that you're going to be forced in some way around this issue. We know some people got concerns around side effects of the vaccine. I did have side effects. I had kind of like a flu-like symptoms. I had a dry throat, my back was aching with the injection in my arm that hurt for a number of days. I took some paracetamols, and after about 3-4 days, I was fine. my parents, who were in their late 80s, they took the vaccine, and actually they had no side effects. So it depends on your physiology of your body, how it all works out, to be quite honest, in many ways. And there is now more and more information coming out explain about the implications of the vaccine for your health. And I know people who've got serious health conditions have decided to take the vaccine as well. And I've got no selfish reason why I've taken the vaccine. I love traveling. Seriously, I can't wait. Don't know when I can jump on a plane without a mask. We may have to wear a mask in the way things are going, but to go and travel around the world. And I think it's important that if you want to explore the world, we have to recognise that some parts of the world will have a certain degree of expectation of taking your test, your COVID test, as well as evidence that you may have to take a vaccine. Let's see what happens. The final point I want to make is that we've lost too many people in the community, far too many. Every other day I get a message of sad news of someone dying of COVID-19. It's all about saving lives. So for those of you that are online tonight and you're still not quite sure, please think about it seriously, because if we can get around this corner, we can fight for another day. I'm a campaigner and an activist. I want to live and be involved in campaigning so we have a better humanity. So please, please, please think about the vaccine, talk to friends, talk to people who have taken the vaccine, ask for their opinion, and ultimately, it's your choice, but it's about saving lives too.
Thank you, Patrick. Gratefully appreciated for your time. And there's some questions coming through that I know you will answer a bit later on. I'd now like to introduce you to Dr. Genevieve Small, who Genevieve's a GP in Harrow. She is the chair of the National Health Service Harrow Clinical Commissioning Group, which represents all the GPs within Harrow itself. As I said earlier, she also sits on the council's Health and Wellbeing Board and is the vice chair. So, Genevieve.
Thanks very much, Graham, and very difficult to follow Patrick, who is such a fantastic advocate for lots of the things that we really do want to talk to you about tonight and listen to your questions. So I will do this slide, and then we can probably take the slideshow down for a bit, if I think, because there's just not so much to say that I want to say that's going to be useful with the slide. Thank you for inviting me back. I have to say that when I last came and did this talk, we were just at the beginning of the COVID vaccination program, really. I think that was early January. And we've achieved so much in the last 8 weeks. I have to say it's been a really phenomenal vaccination program going on. And I absolutely recognise, as one of the members of the audience have written in the chat, that we are in this situation because of the amazing talent of the scientists who have put in the dedication to be able to deliver these vaccines in an unprecedented way. But we have in Harrow worked very hard to deliver the vaccine programme, and many of you listening and watching in will know that we've got 3 centres currently in Harrow, one at the Hive, one at Byron Hall at the back of the leisure centre, and the other in Tithe Farm. And over the course of the last 10 weeks or so, we have literally vaccinated thousands of Harrow people. And it has been an extraordinary programme run by GPs and teams around the GPs, supported by some incredible volunteers who really do make the whole process run incredibly well. And we've had lots of comments back from people saying that it was a very efficient process, and they weren't really in the centres too long before they were well on their way home again. And we have achieved some fantastic coverage. And I have to say that Harrow has been the shining star in vaccination uptake across the whole of Northwest London and practically London. Without wanting to blow our own trumpets, it's nice to to also recognise that we have done phenomenally well, and we have vaccinated in the main the top 4 cohorts that the JCVI stipulated. So that is people in care homes, care home workers, people over the age of 80, people over the age of 70, and those in the clinically extremely vulnerable group, as well as health and social care professionals. And we've done most of that rollout very well, and we are also now extending into those people who are over the age of 65, and those people who are at moderate or higher risk of developing COVID complications. So the easier way to say that is to say basically those people who tend to be allowed to have a flu jab. There's a few little variations in there, but that's the main groups that we're vaccinating. But I want to pick up on the fact that although this is a really successful program, we absolutely recognize that there are some people who are uncertain about whether they want to proceed with a vaccine. And that is the group of people that we definitely want to have conversations with. And I think, as Patrick outlined, a lot of these are questions that people have in regard to some information they need to have about the vaccine, and we're very, very happy to have those conversations. And they're also where people are unsure because of past experiences or mistrust, as Patrick has said. And those are the people that obviously we appreciate need to have more time for them to make sure that they're making the right decision for them. So we, as GPs and across many parts of Harrow, are having a range of different conversations, and they are genuine conversations. They are an opportunity for us to talk to you about any concerns or fears that you may have, for us to tell you places where we can provide you with the information that we think are the right sources, and to give you the opportunity to go away and think about it. Please don't feel that the door ever closes in terms of having the COVID vaccination. If you don't want it now and you feel like your age has kind of like moved on to another lower age, don't worry about that. Come back to us and tell us if you want to ask more questions, you want to change your mind. There are some people that can't have the COVID vaccine for a little bit. For instance, those people who are 28 days ago, unless 28 days have passed since they've had COVID themselves. So for those people, we need to make sure that we are absolutely going back to them and checking to make sure that they are also having the vaccine. So whilst we move on to the newer cohorts of people, we are also going back and checking to make sure that we haven't missed anybody off that wants to have the vaccine, or anybody that feels that they are now ready to receive the vaccine. We want to pick that up. There are some questions in the chat about second doses, so I might just cover those now. Everybody is going to have a second dose. So, and the dose works by, if you had one of the vaccines, we've currently got 3 vaccines approved for vaccination in the UK at the moment. We've got the Pfizer vaccine, we've got the AstraZeneca vaccine, which some people call the Oxford vaccine, and then we've got the Moderna vaccine. Now, we don't have any Moderna stock in Harrow, so we are concentrating on those 2 vaccines, the Pfizer and the AstraZeneca, and they are similar but slightly different. And if you had the Pfizer vaccine, your second dose will be the Pfizer vaccine, and the same for AstraZeneca. If you had AstraZeneca, you will have AstraZeneca second. And in the main, people are having their vaccinations, and they will be coming up for 10 to 12 weeks after their first vaccination, to make sure that we complete the course for them. And you will have heard on the news that on the news and the press briefings that Jonathan Van Tam has said that we're likely to look at some sort of booster dose coming into the autumn. We don't have any details about that yet. We don't know what that might involve, but it's just worth saying that this is an ongoing program, an opportunity for us to make sure that we're delivering the right vaccines to people as and when we need to give them to them. I'm going to pick up another couple of points. So one person asked about immunosuppression. How do we know that somebody who's immunosuppressed, whether they've actually made any antibodies, and can they have a test? The short answer to that is no, we're not offering tests to see whether people have actually had the antibodies raised. But there is research going on all the time that looks at that particular group of people, and that research is happening in research centres. So and they will check to see what the antibody response is for people who are immunosuppressed. If you are immunosuppressed, please still have the vaccine. It is really important that by having the vaccine, you raise the memory cells in your body. And even though it may be different to somebody who doesn't have that immunity problem, it's still absolutely worthwhile. And you should have 2 doses. And we now know that people who may become immunosuppressed, so they may be about to start cancer treatment or something like that, those people should have their 2 doses before they get the starting their treatment or have an operation that could affect their immunity. So we are learning and researching and gaining experience in this all the time. We also know, and this came out in the last 10 days or so, that the government's looked again at people who might need shielding. Now, those people have received letters and are now in a shielding list. And we are able to see that, and we will be inviting those people who are new to the shielding system to also be invited in for their vaccination. And somebody asked the question about whether those people can have it as a home visit. Initially, we were really careful that we wouldn't be able to do things like home visits because the Pfizer vaccine is quite complicated to move around. The AstraZeneca vaccine is able to be moved around. What we have to make sure is that when we open a vial of AstraZeneca, we don't waste any. So we need to make sure that we've got enough people that need to be vaccinated to enable us to use that AstraZeneca vaccine in the right way. So we are cohorting people together into groups in order to have home visits. And the fact that AstraZeneca vaccine is a little bit more transportable means that we are also now able to do what we're calling pop-up clinics. So it means that for some people, it might be easier for them to go to their local practice or to a community centre to enable them to get access to the vaccine. And if that's the case, then our GP colleagues are working out where those sorts of things should best happen. So we've got a range of different ways that people can have the vaccine, be it in one of the bigger centres, one of the smaller centres, even in their own home if we can do that, or we're taking it to care homes. So I just wanted to kind of like give you an overview of the range of different ways that we're vaccinating people. I'm sure there will be lots of different questions that people have to answer, but I'll just stop there at that point.
Thank you, Genevieve. And I think it's quite important, you know, the vaccination rollout in Harrow is going exceptionally well. People have thanked the NHS and the council and the other support services around, but also we should thank the numerous hundreds of volunteers that are also helping to keep these centres going, when, you know, as putting their own time in to make sure it operates very well, but also picks up that important point as well. There's a number of different ways that the vaccine can be delivered. So people in care homes, they're being visited. We've got the major, from right through to the major vaccination centres that will be in place. So there's a number of options that will address some of the questions that have been raised, but we will come back to some of those later on. We now have, before I introduce Dr. Amit Buckeye, we do have a short video which has been produced by the Harrow community leaders and health and social care staff. We should credit Eileen Anto and Arunima Basu, who are medical students from Imperial College London, who led on the production of this video with the Harrow community. So thank you very much. So.
The experience of taking the vaccine were absolutely brilliant.
Really wonderful.
The operation was effective. It was like a celebration. Everyone was like smiling, happy.
When it was my chance
and I got a chance to go and get it, I just dropped everything.
It's just like the last time I had my rubella injection, really. Sore arm, and that was it.
I had a heavy arm for about a couple of days. I took paracetamol for 2 days, and then, yes, that was fine.
I had absolutely no problems.
My arm was a little bit sore, but after 2 or 3 days, a little bit only. It just, you can have it with any of the injections you have there.
For a little bit of itching or a little bit of fever, my goodness me, it's a very small price to pay for an absolutely wonderful cover that you're going to get. It's your insurance policy against COVID.
It's firstly personal protection.
And I didn't want to lose any more patients, and vaccinations offered a beacon of hope. It was light at the end of the tunnel that I felt.
So for me, it's almost a godsend in many respects.
Save yourself as well as the others.
As a person who suffered from COVID symptoms, I think even if there is a slight chance of having reaction post-vaccination, I believe the symptoms of that are a lot less severe.
If family get affected, then you really, get concerned and want to go for it.
Okay, if they come and say, this hand got vaccine, this hand got coronavirus, which one would you go for? So definitely I thought I would go for the vaccine.
So I really feel protected and safeguarded.
It's really, really important, and I'm thrilled actually that so many of my community have been vaccinated already.
It gives you confidence, even if it's only a little bit of psychological confidence. There's a confidence that things will get better.
So these scientists, they have done years of research. They know what they're talking about.
And the science is telling us that the vaccine is there as a force for good.
It's available, and thank goodness it's available. It's wonderful.
Important for the future of our children, for the safety of our loved ones. There's no Satan and no conspiracy behind it.
Nobody would produce a vaccine that was going to be anything but right for people.
If there is a solution here, why don't I take it?
So I've been writing and saying, grab your jab. Grab a jab, everybody. Get out there, go and take it.
I think vaccination is for me. Things start opening up.
And so the more people who have it, the better it'll be for everybody.
I would encourage everyone to take this, honestly. In my world and in my circle of friends, we all decided we're going to go forward with it.
Already we have a year that is, we know what is it is, how many lives we lost. So we have to be careful about that, and we have to take the vaccination.
I want to encourage people, to be honest, all my family had vaccine.
Have it because this is for the community.
This would be the only way now, currently, to deal with this situation, to get back, for all of us to get back to some kind of normalcy.
It might prevent me from going through long COVID and all the, the effects that you might have after COVID.
I think as a person who has been through it and got people around who either have suffered or we've lost, all the more reason to, read up on it and get to know the situation and then go for it.
And also, if you hear things that maybe social media are saying or something, is investigate it yourself. Look further. Don't believe all that you hear and read.
And we have vaccinations. We live in a world of vaccinations. The reason why polio is no longer common is because of vaccination.
I want the whole world to get the vaccination. Let us get our youngsters back to work, and let's build up the country. This is not Britain. This is Great Britain.
That's an excellent video, and it's available online, and we will send a link out so you can share with others. I'd like now to take the opportunity to welcome Dr. Amit Bakai. Dr. Bakai is a consultant cardiologist and research director at the Royal Free London NHS Trust. He is also a Harvard scholar and the author of dozens of medical research papers, and has run a range of clinical trials that have enabled innovation in the field of cardiac research. So, Dr. Amit, welcome tonight.
Thank you so much.
And it's a great pleasure and a great honor to be here with all of you. I've had my vaccine, and Sudhish, I don't know if you can just go to the camera for 1 second. What? And there it is. And again, I had it just before the turn of the new year because I managed to be on call for the second peak as well as the first peak in April. And I couldn't have said things better than this video and the team that you've got around here. And all of this is about trust. It's all about having people to talk to if you have your concerns. And I just want to remind people very shortly, I just want to touch on the idea of what exactly it is that we're actually going to war against. Now, the vaccine itself does not care about us. It is the most incredible, please go to the next slide for this. Thank you so much. It is the most incredible warrior, as we call it, of photocopying in the world. Keep going, next slide. It's all its job is to find a host, infect, infiltrate, replicate, and spread. And it occasionally will sleep inside you. It will mutate inside you to try and be a better capturer of other people. And so it only takes one vaccine molecule, sorry, one virus molecule to mutate, and the war starts again. You cannot turn your back on something like this. And if we look at the next slide, the vaccine leaves this sort of damage in your lungs. On the left-hand side, a normal X-rays at the top, a normal CT scan, and on the right-hand side, you can see this incredible war zone, these clouds of scars it's causing, which is called adult distress syndrome, adult respiratory distress syndrome. This is what it causes, so that we end up needing oxygen, we end up needing non-invasive ventilation, we end up needing ITU ventilators and so forth. And hopefully we make it through this. But of course, we've seen that a lot of people didn't make it through COVID. I have to tell you one sad fact, which is that in 20 years of my entire career as a consultant and a specialist, I have never known our morgues to be full and not have space for the next person. And I actually had to witness that in April, and we were almost at that point in January. This is the sad reality of what we're facing. And you saw in that video, if you had a choice between getting COVID pneumonia, getting long COVID, the complications of COVID after 3 months, or getting a vaccine, it's a no-brainer for us as staff. So let me tell you what's happening in the staff setting in the NHS. Next slide, please. Here you can see in pink the people, this is from 13,000 staff that are reporting their seroconversion, their likelihood of a test becoming positive when they're testing themselves twice a week to see if they're fit to go to work. The people in pink have had their first dose of vaccine, and you can see after 12 days this immediate drop-off of their own likelihood of catching COVID-19. But the other beauty is that they're actually protecting the staff that haven't yet had their first dose of vaccine. So you get that double protection, triple protection as an NHS staff member or healthcare professional. You're protecting yourself, you're protecting your staff, and you'll be protecting not only your families, but also other patients. And so you can see this immediate impact of the first dose. After day 12, there's a clear separation in our staff. This is a beautiful study coming out of King's, the COVID symptom study, the Zoe app. 4.5 million people are using the app to say what's going on with them. Over 1 million people have reported what their side effects. And let's have a look at those side effects. If we look at the next slide, actually, let's go 2 slides forward and I'll come back to this. Sorry about that, Sudhish. Go 1 more forward. And then here are the reports of after the first dose. These are thousands and thousands of people that are using this app, us as the public, actually reporting that within about a day and a half after the first dose, only about 2 to 3% of people have symptoms that are of any significance. And after the second dose, it goes up to about 5–6%. But immediately after about 2 days again, 3 days again, it's down to below 5% having symptoms that are because of the vaccine itself. So the vaccine, 95% of people after 3 days will have no symptoms after the second dose, 98% after the first dose. And we are, of course, reporting on those small percentage of people that are getting important side effects. If we go back 2 slides, this is the most amazing thing about the UK. The UK people actually report what's going on, and we put that data back into the public domain. This is the MHRA, the Medicines Regulatory Healthcare Agency itself, showing us what's been going on. Anybody can report a yellow card system. be it a person in the public, be it a clinician, be it a pharmacist, be it a nurse, anybody can say, hey, this is what's happened to this person after vaccines. And actually, let's see those reports. In the next slide, you'll see that of the 7.5 million doses that were reported to in January, only about 16,000 people after the first dose of Pfizer-BioNTech and second dose, 16,500 people, just over that, and 6,000 people gave reports on the AstraZeneca Oxford vaccine. If you total up those reports, and most of those reports are about anaphylaxis or allergic reactions or muscle pains or a sort of a nerve involvement or a fatigue, most of those things were beautifully well categorized, really well documented. This report is in the public domain, and it equates to less than 1 in 250 to 1 in 350 people actually reporting important side effects. So 249 to 349 people out of 300, their denominator of 250 or 350, are not even needing to report any dangerous side effects after the vaccine. And we are still collecting data on anything that is going on due to the vaccine. So the transparency of great data in the public domain, anyone can click on these links, anyone can see these reports and actually generate that data. So if we go to my last slide, please, Sadish. The last slide is, there are 3 messages. Compare the importance of COVID pneumonia versus the vaccine itself. No brainer, have the vaccine. Compare the idea of trust. Everybody knows people that they can talk to and understand what are my issues. And when we do share those concerns, we can find the data. We can find the trusted individuals. We can find those people who understand the data to be able to give those answers. And community events like this are so precious, so good to do. You know, I can't thank Harrow Council, my own area that I live in, for doing this. But there are 2 other important messages: that general practice is open for business. Hospitals are open for routine business. We've seen this massive drop-off of cancer rates being detected or picked up during the COVID pandemic, during people locking down. And actually, we need to be suspicious of any symptoms you have that may be for cancer. Please come back in and get those checked out. Don't hide or sit on anything. We're open for business. And the next one is cardiology, my specialty. We've seen a 50% drop-off in people coming in with chest pain. They're actually sitting on these chest pains at home, and actually they come too late with their heart attack. They come with weakened hearts. They come with lining of the heart being affected, etc. They come with valve disease and collapses and emergency rather than coming earlier. And we again want to say to you, we're open for business. Do not ignore chest pains and new onset breathlessness and palpitations. You know, please come back to us as you would have done before the pandemic. The most important message is prevention is better than cure. In heart disease, prevention early on, pick up in cancer, and prevention of COVID through the vaccines. So I hope those messages are really clear. Last slide, please. Take home messages: vaccines, cancer, we're open for business. Stay safe, look after yourself, empower yourself. Please talk to people. Please use the resources like us around you. We're really happy to help you. It's a privilege and an honor to help and serve you and to give you the confidence that you need to look after yourself and each other. Thank you so much.
Thank you very much, Amit. There's a lot of strong messages have come out for all of the presentations and tonight. I'd just like to add one other point in. I didn't say at the beginning, but it's following on from what Dr. Amit has said. One of my family members works in a hospital, previously had pneumonia, has had a number of serious operations. Because he works in a hospital, he was vaccinated over Christmas. He was tested positive in January, but they believe that he had much milder symptoms because he had had the vaccination. And that's the difference with it. It doesn't stop the virus, but it reduces the symptoms down so much that you reduce the number of people going into hospital. And if you see the pictures of people in hospital, the doctors here would have seen them. It is frightening, really, because even when you come out of that seriousness, you go home and then it takes weeks and sometimes teaching people to walk again, and you don't want to end up in that position. So while some people have mild symptoms, some are stronger, but the thing that saves most people would be the vaccination. We have a number of questions that come through. My screen is very small, so I can't. I'm trying to juggle between two screens, to be fair. Before I go to the questions, there's one I will answer first, beginning myself. There is a poll at the end of the event to test whether attendees found it useful, informative, and what we should change and what people will be interested in going forward. So if you could fill that when it comes up, it'd be gratefully appreciated. One of the questions that has come up is more than once is around how we'd supporting people who are homeless or in temporary accommodation. I was on a meeting earlier on when we was going through all this, and the Harrow Housing Needs Department is working with other West London boroughs and North West London CCG, which is part of the Genevieve's group, are organising COVID-19 vaccinations for homeless households, currently accommodated in shared emergency and temporary accommodation. This is mainly targeted at people living in bed and breakfast and hotel accommodation. And the council has contacted the establishments to advise them of the programme and to encourage them to provide the necessary support to ensure that every homeless person accommodated gets vaccinated. North West London CCG nurses have started the process of scheduling the vaccinations, which will be delivered in the coming weeks. As another point, questions that are coming through is one is follows actually on from what Dr. Meach was saying about if people are feeling ill and need to come to doctors. It is important that you still contact your GP. Make sure that it doesn't go too far down the line. And what the NHS have done across the whole of North West London is moving some of the services around so they're in a COVID safe environment, which makes sure that people, especially the cancer pathway, can actually be moved in and diagnosed very quickly. But it might not be a hospital you normally go to, but it would be places where they've reduced the COVID patients down. If I ask the panel themselves, is there any questions that you've seen come, because my screen's so small, it's a shame I can't read them all. I know some have been answered directly by this we've been going through. Is there any questions in there that you would like to answer live at this moment in time?
Graham, would it be okay if I answered the question that was put about places of worship, and Carol may want to comment on that as well?
Of course, yes.
So I'll leave the science to Carol, but one of the things that the rules did allow after the lockdown was the continuation of places of worship remaining open. Because of the very, very high levels of coronavirus in London at the time, both Public Health England and other partners talked to council leaders across London and suggested that consideration should be given to encouraging places of worship to think about whether or not in that context it would be sensible for them to remain open in order to do everything that was possible to reduce the spread. And that was supported by many religious organisations across the capital. Clearly, the level of coronavirus has dropped quite sharply, as Carol has said, and very much like the situation in schools, places of worship provide very important spiritual and other support for people, and that's something that needs to be balanced against any risks. And obviously, there's lots of advice, and places of worship worked incredibly hard to make their buildings secure, and that we know in Harrow that as the case rates have reduced, and a number of places of worship have worked very hard and started to slowly reopen at this point in time. And clearly, that's something that the council would support them doing if they feel that they can do that in a safe manner, given that we are in a better situation. But Carol, I don't know whether you want to add anything to that.
No, Sean. I think that's right. we're keen that if people are going to open, that they do it in a COVID secure manner. The more mixing and the more people in any one venue, the more chance of people getting COVID. So if you are going to open a place of worship, you need to be really scrupulous about people using hand sanitizer, about the social distancing inside, keeping windows and doors open so that you get a lot of ventilation, and of course everybody wearing masks, because we don't want the aerosolized virus to be in any quantity within that environment, because any contact, it does provide a risk. You also need to think about any surfaces that people might touch. So if there are chairs or pews or fabrics, because we know that, you know, from some recent research that the virus stays alive on fabrics and viable on fabrics for a few days. You know, so you do need to be really careful. But you know, if places want to open, we will support you to do that safely.
Thank you. As I said at the beginning, with the variant that came through from Kent in mid-December, and the rates were escalating at a rapid pace throughout late December, quite a few people were cancelling their time off to come into work because of the escalating levels we were seeing. And we was on conference calls with Carol and Sean, the health service, really worried, to be honest. And as we got into near New Year, we had a number of conversations at a very national level because of the rates of infection that were coming across Harrow. And so I think I'm eternally grateful for the organisation, the religious organisations and community groups, when we wrote to you to ask, although the national guidance would say you could open, that we was asking you to reduce that right down to try and break the back of the COVID pandemic. And I honestly believe, from all the information I've seen, the briefings I've had, that actually worked in some sense. And the schools were asked, some schools were asked to close, ours was asked to close at a very late notice. We managed to do that. But I think it's all these things together, people working across, not just closing schools, but the way people have acted and reducing the number of that contact down has allowed the virus to sort of reduce down to a level that is still higher than late November last year, when we were in tier 3, whatever it was, in the tier system. So as we're coming out of this, yes, you can open, but I would ask us, as Carol and Sean are saying, we need to be very careful of how we do it and make sure we can maintain that distance and space and follow that public health guidance until we know that COVID is completely under control. Does anyone else, so Genevieve?
So I'm realizing that I was quite remiss in not actually talking about another part of what I was billed to talk about. And Stephen has made the comment about when will general practice be fully open. So I just wondered whether I should just touch on that briefly. So along with the difficult decisions that Councillor Henson's talking about for the community, as part of the second surge planning for COVID, and also to enable us to get a good start on the COVID vaccination programme, we did make the decision to stand down some of our more routine elements of general practice. So you will remember back in the first surge in April last year, that was something that we had to do. And then we reopened all of our services in general practice in the kind of spring, summer months until January. But general practice, even in the spring, summer months and into the remainder of last year, wasn't really what people think of as general practice. And I think that I do understand the frustration that people feel when they would like to just basically walk into their GP surgeries, which I completely understand. And nothing is more heartbreaking to me than to look at my own surgery and think that from the outside it looks closed. It isn't closed. It absolutely isn't closed. As you can probably see from me now, I'm still sitting here. But we are being cautious about who we do bring into the surgery. And that is just for the very good reason that we would never want to put a patient at risk from coming into a building unnecessarily. And so we've learned some tips and skills to help us along the way by using some online consultations, by using the telephone much more. As you will probably recognize, we can do clever things by sending you a text, so you can send us photos and have a text dialogue with you. And we can do video consultations, but sometimes there's no substitute for the fact that we need to see you face to face. And if that's the case, then we absolutely are bringing people into the surgery and doing that. And as we enter the spring again now, and we see the country opening up more, we hope to be able to get to a much more normal looking general practice, but we're never probably going to lose some of those tips and tricks and skills that we've learned over the last 12 months. We are going to have the ability to do far more virtually in the future. And for some people, it works really well, and it actually makes us a much more responsive service for people to achieve. For some people, it's not, you know, they want to come back into the surgeries, and I'm looking forward to that day too, because I actually really like talking to patients in my surgery as opposed to virtually. But I think that it's a very variable feast, and we appreciate that some of the surgeries in Harrow are quite small, and we must be careful, especially if we bring people into that sort of environment, that we're making sure that we're maintaining the social distancing that people need and that we're looking after them completely. But I would say to you, general practice is 100% open, and as Amit was saying, we're very, very conscious of the fact that some people may be sitting at home, not one thinking to themselves, oh, I won't bother the doctor about that. Oh, I'll leave it a bit longer. I don't want to be a problem. All of those things. Please don't do that. If you're worried, please, please make contact with us. And I would especially make that plea to you from the mental health point of view. This is a challenging time for all of us. We've all had to dig really deep into our own resource bucket, really, to help us through this period of time. And actually, we're all having mental health wobbles. And if you want to reach out and actually get some additional support, please do. And we are really, really keen to talk to you about those things, because there are many things that we can offer you. And this is the long legacy of COVID. Could not just be COVID. It could be all of the other things that we just didn't get a chance to look into. So don't sit there and worry. Give us a ring.
Thank you, Genevieve. While your microphone's still on, there is another couple of questions coming through about people who've had the first vaccine but haven't been notified about the second one and fear of not being able to book it.
Yes, thank you for highlighting that, Graham. I'm conscious that is a worry for people, and I have to say, I'm really sorry you're having these worries. Please don't worry. But it's slightly complicated, and I'll bore you for a couple of minutes on the reason. Basically, you will know that we're using text messaging services to get people in for their vaccines, and the text messaging service that we're using hadn't completely geared itself up for the delay in the vaccine. It was really there for the idea of being the recall system in at 3 weeks or 4 weeks, and it hadn't got to 10 weeks or 12 weeks. So as a consequence of that, the different centres have come to different workaround solutions, basically. And the Hive has got a record, 100% has got a record of every single vaccine that they've given you, and it's in your GP notes as well. And if you have an NHS app and you go on the NHS app, you can see that you've got on your mobile phone, you'll be able to see that you've got your vaccine logged there. But the Hive will be contacting you closer to the time. I did see somebody in the chat saying they've got it coming this weekend, so they should be hearing imminently for that. But it's important that obviously when you turn up, we've got vaccine to give you. And so that's a kind of national logistical problem that the national office needs to sort out. But that's why they are holding fire on sending you the appointments. The other two places decided to give you appointments. Now, that may vary if they haven't got vaccine on the particular day. So you may hear a different day, but I think that people like to feel they've got that appointment in the bag. I completely understand that feeling, but it's just that they've come to different workaround solutions to this IT glitch.
Thank you, Genevieve. There is some...
Great, Graham, can I answer a question?
Of course, Carol.
Yeah. Yeah, somebody was asking about isolation and how do we know if people are isolating, because as they very rightly say, it's test, trace and isolate, and isolation is absolutely vital. We can't be entirely sure that people are isolating. We do give people a call and try and ensure that they know that they're supposed to isolate, but you know, we don't check on them every day and make sure that they're in their house. We don't electronically tag them, although I do think that might be a good idea. But we are looking at you know, at how we can support people. So I think the really important thing is if people have a problem with being able to isolate, that there are support services available. We have the Help Harrow line, so that can provide you with food and support. We have befriending services linked into that. People that can pick up your medication if you need something picking up from the pharmacy. And we also have the £500 self-isolation grant that's available for people who are on low income. And if you're in a temporary hardship, we also have some discretionary funds that we might be able to make available for people as well. And if you're a small business, you could be entitled to money from the business grants that are available. So there is support. So, and I can't stress how important it is that if you have symptoms, get a test and isolate until you get your results. If the results are positive, isolate for 10 days. And your whole household also needs to isolate for a full 10 days if you're positive. And, you know, that's got to be a really important message to get across to people.
There is some questions about the vaccine itself, which we'll come back to. There's one in here I was just reading that really maybe Patrick will be able to answer. It's there is genuine questions and concerns in parts of the community who are really fearful about the vaccine itself, but mainly in the older generation or the older generation. I just wondered, how would you put that message across to give that confidence or to family, friends and the community themselves to try and give them an encouragement that it's safe from the messages you've heard tonight?
Yes, sure. I think you saw the video, and that video reflected the diversity of people, staff, residents of Harrow, of different ages, of different ethnicities. I said before, my parents, my dad's going to be 90 in a few months' time. He took the vaccine, and he loves walking. And the reason why he took the vaccine, because he wants to start walking again. He likes to go to the market with his trolley and does his shopping and stuff like that. All I can say is we acknowledge your concerns. That's why it's important for you to talk to your local GP, speak to family members, and speak to anyone that you know who have taken the vaccine, actually. And I think more and more elders are taking the vaccine. My concern, to be quite honest, is when we reach young people. I think that's going to be a bigger issue, because they are more linked into social media and all the conspiracy theories that's been floating around for the last 11 months. And it's going to be a lot of hard work to convince young people about the vaccine, if you want my honest opinion. So we keep going. People will eventually take it. More and more elders are taking it. I'll give you one little antidote. There's a friend of mine who's a journalist. He knocked his next door neighbour, social distance, say, "Are you all right?" He said he's 81 years old from Trinidad. He said, "I'm not taking a vaccine. It's all a conspiracy theory. They want to experiment on us as black people." He gave him a link to a video I talked about why I took the vaccine, and guess what? Last week he took the vaccine. I'm not saying because it was me, but what I'm trying to say is it's all about trusted voices and talking, and people get it. As long as if you force people, they won't take it. And I think that's a message for all of us. We're here on tonight because we care about the community. We care about you, and we want you to seriously think about all the information you've heard tonight. And if you've still got doubts tonight, still ask the question. There's nothing wrong in that.
Thank you, Patrick. There is a question as well, really, from Dr. Amit. There was his presentation has some very graphic material on there. And the question really is, why do you still need the vaccine if you've already had COVID-19?
Thank you so much. And unfortunately, there are a small proportion of people, as I said to you, the virus can be latent or a mutation can infect you. So you can still get another variant of COVID-19, or you could get your own COVID-19 reactivated. Very important to understand that we don't know everything about COVID. We don't know everything about long COVID. Some of the questions and answers about pregnancy that we've had, we're going to be able to tell you that we haven't done it in the initial trials, but we are already planning trials for women with pregnancy, women that are about to become pregnant, women that are currently pregnant, the vaccine, so we can generate more data. Where we don't have data from a proper clinical trial, we're getting observational data of people who've had vaccine and then found out that they were already pregnant when they had it, and we're reporting that. The beauty is that wherever we can, we're sharing best consensus practice based on the evidence base, but we don't have evidence of everything. A lot of questions about how long will the first vaccine last. We don't know exactly. We're following people up really carefully, thousands and thousands of people. And I just wanted to make a small plug about thank you for all of you who've been participating in research. In COVID-19, it has been the most fantastic year to do research because everybody has volunteered. We've had 50,000 volunteers within 3 months telling us we would like to volunteer for vaccine research. We've had people volunteering for long COVID research. Research has been so easy to conduct when you've got thousands and thousands or tens of thousands of people. Now, I wish it was like that for heart attacks, wish it was like that for cancer. That's why we've been able to achieve so much. And we will be able to answer more questions as time goes along. And guess what? There are 2 other ways that we'll be able to find treatments for you to augment your immunity, to actually give you memory for vaccines and the actual COVID itself. So there are so many different ways we're going to give you to actually protect yourself, not against just COVID-19, COVID 2029, etc. So the world is actually turned a major corner in science. It's a really amazing place to be at the moment for research, for clinical work, but you've got to reach back out. We're reaching out to you, reach back out so we can give you all these benefits. And as Patrick has said, trust, communication, converse, all of our GPs, all of our clinicians, we're all nurses, pharmacists, they're all here for you. And it's just a joy to look after each other.
Thank you. We've had a very lengthy debate and we've answered quite a few of the questions. Some of those questions will be answered separately. I just think as we sort of start winding up, I think they're going to put the poll up in a minute, as I mentioned earlier, to test whether attendees found it useful or not. It's just popped up now. If you could fill that in, it would be great. I just want to ask the panelists if they want to come back with any points that they'd like to, closing comments really while the poll's underway. So if we go to the order that we came in with, Carol, do you want to start?
Yeah, I'm going to start. I'm going to say my good news is that I'm getting my vaccine tomorrow afternoon, and it feels like it's going to be Christmas all over again. I can't believe how emotional I feel about having a jab. Yeah, I feel like I'm joining an exclusive club. couldn't be happier.
Thank you, Carol. Patrick?
I'm taking my second jab in a few weeks' time, and I'll be posting on social media again when I've taken that. What's interesting, I just want to thank everyone who's seen my various messages on social media over the last few weeks, who I've encouraged. I'm very happy to talk to anyone, to share my experiences, but please, 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 you know, we need to live for another day. The vaccine's important. All your concerns, and lots of concerns in the messages about autism, about pregnancy, about vaccination centres, I'm sure everyone, those questions will be answered. And just when you go back home, even though we are home, it's weird, isn't it? Even though we are home, just talk to friends and neighbours. The more we talk, the much better it will be. And you're not alone. You are definitely not alone. Over 20 million people have taken it in Britain, so you're definitely not alone.
Thank you, Patrick. Genevieve?
I really want to say what a privilege it's been tonight to hear all of the other speakers speak with so much passion and enthusiasm about this project. It's really been an extraordinary time for us in Harrow, and this is a really positive way for us to hopefully vaccinate ourselves out of the crisis that we're in. I think that there's lots of questions in the chat that are very specific to individual people, and we couldn't do justice to those conversations tonight. But if you feel that you should have been called for a vaccine and there's something that's putting you off, maybe it's logistics, maybe it's you know, the centres are not the right size, or you've just got some questions that you want to ask, then I would actually encourage you to pick up the phone or do an online questionnaire, as we like to have in general practice now, and do one of those and actually just see if the practice can come back to you with some answers, because we've got some really novel ways of supporting people and pop-up clinics and all of these sorts of things. And if you don't quite fit into a perfect box, because actually nobody does, we're all unique, then you know, make contact with the GP surgery to see if we can find a way around some of the problems that you might be experiencing.
Thank you, Genevieve. And Amit?
Thank you so much. And I just want to say that health is a universal right. Doesn't matter who you are, doesn't matter what color, race, gender, social class, everyone deserves good health. Everyone deserves to be helped to look after themselves. Disease and vaccines do not care who you are. So if we're trying to help you, reach back, take that help, look after yourself. Let us help you look after yourself. The most privileged thing I can do is to help you not meet me in a hospital setting. Come and meet me in the park. Come and meet me on the tennis courts. You know, that's where I want to see you. I don't really want to see you at ITU.
Thank you very much. Sean had to leave to go to another meeting at 7:30. So so it leaves me now really to thank everyone for coming along tonight. Especially there's a panel tonight who've given their time and sort of tried to explain and put people's fears at rest, but also for the community who are doing so much to try and spread those messages out. You know, as a council or the health service, we can't really push out to everyone and sort of expect the message to get through. It does need those other voices to give the facts about what's going on. There is a genuine fear and concern around the whole of COVID, and there's a fear around the vaccine, and it's you know, we've been dealing with this for over a year now, and people have gone through very traumatic times, and we can hopefully see the end of the tunnel, and people do have concerns, is it the right way we're going? But as you said, as someone said, you know, we've been 20 million vaccines so far in the UK. I don't think there's been any adverse effects to it, but as we can all give examples of where it's had a positive effect, where when they have got COVID, it's massively reduced symptoms. So science can control the virus in the sense that we can't, if we don't get vaccinated, then we're at risk of this continuing for some time, long time into the future. So we look forward with hope, now hope for a brighter future, the hope that when we can play tennis with Dr. Amit, when we can all sort of meet up again and in a safe environment. And I think we can do that well with the people who are here. So please pass the message on, and thank you for your time tonight. Thank you.